Yeah, I mean, so I kind of stumbled into conversational solutions about 2 or 3 years ago when I sent my daughter to an accelerator program in the US. And, she'd faced some significant challenges with her friends, one friend in particular who had been diagnosed with anorexia. And Alexander had gone online and done the research like all patients do, the normal use case for patient from condition diagnosis online to Dr. Google to oftentimes bad information which is not aligned to the treatment plan. And I think what was most shocking for Alexander in that use case was finding out that not only was the information potentially not the most credible information, but in many cases the information around anorexia online is actually dangerous. It actually encourages patients in bad behavior or how to cover bad behavior. And so for her, this was a monumental frustration and challenge. And so when she was going to this accelerator program, I said, well, why don't you build an app? The logical thing that an adult male would say, why don't you build an app? And within a couple of days of going down to Chicago on this accelerator program, she sent a note back saying, Dad, apps are dead. Teenagers don't use apps. We're all about messaging and chat. And one of the things I've learned over the last couple of years out of this experience working with teenagers is that they are the best harbinger or kind of canary in the coal mine about what technology adults will be adopting. And so what she built over that first summer was so remarkable. When I look back to what I've been trying to do over the last 20 years in digital healthcare, all the barriers that we'd faced in terms of having patients and doctors adopt very complex use cases and information architecture is alleviated when you move into the world of messaging and chat and AI, because the interface that we're using is the most common interface that everyone's using almost every day, which is text or messaging. And so when I saw her, what she accomplished on that, we very quickly scaled that into a new business called Icons.Health, which is really taking those concepts and those ideas and bringing them to global healthcare companies.
Wow.
That are looking to have conversations, because just as you can have a conversation with a friend, maybe we'll have a conversation on Messenger afterwards, you can have a conversation with a brand.
Yeah.
And all the attributes that we would have in our conversation can then translate over into that brand conversation between healthcare brand and patient, healthcare brand and doctor. And that becomes very magical, right? Because the biggest thing I think you probably are seeing with your physicians, the biggest frustration we have in healthcare is the fact that healthcare is very episodic.
Yeah.
You see your patient, and I remember how it worked with me. I would see patients, I would engage in these very rich conversations because that's the only tool I had to drive adherence and outcome. But those conversations are very quickly forgotten. We know that, right? Because patients retain about 10%. And so those great conversations couldn't scale in the past. We moved our patients online, or they went online on their own to fill that information gap, but it wasn't great.
Yeah.
Okay, and so now we've actually hit this kind of new third horizon in digital. We went from web, we went to app, we're now to this new conversational horizon where it's continuous. And now you can take those amazing conversations that take place at point of care, and through digital, you can literally scale those conversations and be an assistant or a partner or a physician that moves in parallel with your patient through their journey. So that's kind of the journey we've been on, is how do we take this new third horizon of digital and translate it into a way that actually brands can use it to meet their objectives. Patients, as you know, it's product adherence, and then outcome. For doctors, it's about product knowledge, it's product script, and it's product loyalty. So exciting, it's been a really exciting time. And I think that one of the things we've definitely seen is that pharma, large global healthcare companies, are very quickly moving towards messaging, chat, and AI.
Yeah. Fascinating.
Probably seeing the same thing with your clients?
Yeah. It's interesting for us. I guess we've seen more voice adoption from non-healthcare clients, like
okay.
just as a sort of thing. But yeah, we definitely see it as part of kind of the mix moving forward.
So I agree with you on that. On the voicing, which has been most shocking for me is how quickly pharma has gone into voice.
Yeah.
Right? I think they recognize, not on the patient side, I think it's a very complex journey on the patient side.
Yeah.
A lot of kind of barriers to that, but when
Yeah.
they see the opportunity at point of care to interact with physicians, I think voice is to them fairly obvious.
Yes.
Right?
Yeah.
They have many years of trying to get a sales rep into a
yeah.
doctor's office, right? Like, how do I get my foot in your door? How do I get there? And now literally you can drop a device that can literally replicate or be that sales rep in that doctor's office. And then you have that complete paradigm shift now in communication, which is going from the push model, which pharma loves, right? Push in, try and gain some time, versus the pull, which is be there when the doctor actually needs you. And that's such a magical thing. So for me as a physician, all of a sudden my head explodes in a way, right? Because I've always thought that pharma had amazing content and functionality and things that I need from a clinical perspective. It's just they were never able to be there when I needed them. Now they can be.